Welcome to RK Edu Nexus. In our random question and answer session, हमारा प्राइमरी गोल है कि आपकी परीक्षा से पहले हम सभी सवालों का कवर करें, जो कि परीक्षा में सबसे ज्यादा संभावित हैं। और ये सवाल पिछले वर्षों के नॉर्सीईटी, AIIMS, RRB, ESI, PGIMR की परीक्षाओं के प्रश्नों पर आधारित हैं। Join us regularly to make sure your selection.
Which of the following drugs is associated with the development of extrapyramidal symptoms, EPS? A. Antipsychotic. B. SSRI. C. Mood stabilizer. D. Anti-anxiety drugs.
निम्नलिखित में से कौन सी दवा एक्स्ट्रापायरामाइडल लक्षण EPS के विकास से जुड़ी है?
Extrapyramidal symptoms, EPS, are movement disorders caused by antipsychotic medications. They include 1. Dystonia, sustained muscle contractions. 2. Parkinsonism, rigidity, slow movement, and tremors. 3. Akathisia, restlessness and an inability to sit still. 4. Tardive dyskinesia, involuntary repetitive movements.
एक्स्ट्रामायराइडल लक्षण EPS एंटीसाइकोटिक दवाओं से उत्पन्न होने वाले आंदोलन संबंधी विकार हैं और इसमें डिस्टोनिया, पार्किंसनिज्म, अकाथेसिया और टार्डिव डिस्किनेसिया शामिल हैं।
Which of the following vitamin deficiencies causes Bitot spots and xerophthalmia? A. Vitamin D. B. Vitamin K. C. Vitamin A. D. Vitamin E.
निम्नलिखित में से किस विटामिन की कमी से बिडोट स्पॉट और ज़ेरोफ्थाल्मिया होता है?
And the answer is option C. Bitot spots and xerophthalmia are both associated with a deficiency in vitamin A. Bitot spots are small, foamy patches that appear on the conjunctiva of the eye and are indicative of a vitamin A deficiency. Xerophthalmia refers to a range of eye conditions caused by insufficient vitamin A, including dryness of the conjunctiva and cornea, night blindness, and eventually, blindness. Vitamin D is primarily involved in bone health. Vitamin K is essential for blood clotting, and vitamin E functions as an antioxidant.
विटामिन ए की कमी से आंखों की समस्याएं हो सकती हैं, जिनमें बिटोट स्पॉट और ज़ेरोफ्थाल्मिया शामिल हैं। बिटोट के धब्बे आंख के कंजंक्टिवा पर छोटे, झागदार धब्बे होते हैं। ज़ेरोफ्थाल्मिया अपर्याप्त विटामिन ए के कारण होने वाली आंखों की स्थितियों की एक श्रृंखला है, जिसमें कंजंक्टिवा और कॉर्निया का सूखापन, रतौंधी और अंतः अंधापन शामिल है।
Which of the following is typically the first sign of infection? A. Fever. B. Nausea. C. Diarrhea. D. All of the above.
निम्नलिखित में से कौन सा आम तौर पर संक्रमण का पहला संकेत है?
And the answer is option A. Fever is often considered the initial and most common symptom of an infection. It is a physiological response of the body's immune system to fight off infection or illness. When the body detects the presence of pathogens such as bacteria or viruses, it releases chemicals that signal the hypothalamus in the brain to raise the body's temperature. This increase in body temperature is known as a fever.
बुखार संक्रमण का एक सामान्य प्रारंभिक लक्षण है। यह शरीर के तापमान को बढ़ाकर रोगजनकों से लड़ने के लिए शरीर की प्रतिरक्षा प्रतिक्रिया है।
Which of the following options correctly represents the incubation period of Taenia solium? A. 6 to 8 weeks. B. 10 to 12 weeks. C. 14 to 20 weeks. D. 20 to 24 weeks. And the answer is option B. 1. The incubation period is the time it takes for an infection to develop and symptoms to appear after initial exposure to a pathogen. 2. Taenia solium is a parasitic tapeworm that can infect humans. 3. The incubation period for Taenia solium is typically between 10 to 12 weeks. 4. During this period, after ingesting the eggs or larvae of Taenia solium through contaminated food or water, the parasite undergoes various stages of development within the human body.
Which of the following conditions warrants avoiding a high potassium diet? A. Chronic kidney disease, CKD. B. Diabetes mellitus. C. Renal failure. D. Both A and C.
And the answer is option D. The condition that warrants avoiding a high potassium diet is chronic kidney disease, CKD, and renal failure. In these conditions, the kidneys may not be able to properly filter excess potassium from the blood, leading to a dangerous buildup of potassium levels in the body. High potassium levels can disrupt the heart's rhythm and pose a serious health risk. Diabetes mellitus, on its own, does not typically necessitate a low potassium diet unless it is accompanied by CKD or renal failure. Therefore, the correct answer would be option D, both A and C. It is important for individuals with CKD or renal failure to follow a low potassium diet as advised by their healthcare provider to manage their condition effectively and reduce the risk of complications.
What are the potential causes of delirium? A. Brain tumor. B. Head trauma. C. Alcohol consumption. D. All of the above. And the answer is option D, delirium causes. A. Brain tumor, abnormal brain cell growth disrupting function. B. Head trauma, injury causing brain swelling or damage. C. Alcohol consumption, impairs cognitive function and judgment. Heavy use may lead to alcohol withdrawal delirium. D. All of the above, brain tumor, head trauma, and alcohol consumption can independently or collectively cause delirium. Delirium may have other causes like medications, infections, or metabolic imbalances.
Which of the following terms describes paranoid thoughts? A. Hallucination. B. Delusion. C. Illusion. D. Anxiety disorder.
And the answer is option B. Delusion describes paranoid thoughts involving fixed false beliefs despite evidence. Hallucination involves false sensory perceptions. Delusion is misinterpreting real stimuli. Anxiety disorder is a broader term for excessive worry. Paranoid thoughts are classified as delusions.
Emergency treatment for cocaine toxicity aims to stabilize the patient's condition. Which of the following options is involved in the stabilization process? A. Kidney functioning. B. Body temperature. C. Heart function. D. All of the above.
And the answer is option D. Emergency treatment of cocaine toxicity addresses vital points: kidney function, hydration, electrolyte balance, body temperature, cooling techniques to prevent organ damage, and heart function, monitoring, medication, supportive care. Addressing these points is crucial due to their interconnections and potential severe consequences. Stabilizing them improves the patient's recovery chances.
And for additional queries, search on YouTube RK Edu Nexus, and get brief note on topics, join our Telegram channel, same name RK Edu Nexus.